Good afternoon, good morning, wherever you are in the world. My name is Dr. Jessica Rose, and today I'm going to give a brief presentation about the problems and harms associated with novel lipid nanoparticle-based prophylactic injection methodologies. First important point that we need to remember is that compendial standards were not adhered to. Critical quality attribute and potency issues remain in the context of the modified LNP-based products. There is DNA in the vials. These are considered to be process-related impurities or PRIs. And very importantly, there's no quantifiable dose. And antigen expression is proportional to the number of mRNA transcripts that are successfully delivered or produced for translation. In a publication that is quite recent, 2023, Dowdy states, it remains entirely unknown mechanistically how entomosomally trapped FDA-approved RNA therapeutics escape into the cytoplasm. And what this effectively means is that there literally is no quantifiable dose. And this is exceptionally important to understand, because we literally have no idea when someone is injected with a certain quantity of mRNA, such as a 30 microgram dose in a 300 microliter liquid suspension, how much spike protein those people are going to subsequently produce, and in which cells, and how many cells, and for how long. The process to modified mRNA synthesis workflow is an upscaling methodology for the purposes of producing a lot of product in a short amount of time for a low cost. Now, the DNA that is produced as part of this workflow is made using plasmid and E. coli systems, which effectively introduces two ways to potentially introduce contamination into the final products. It's important to note that in terms of the clinical products that were used in the clinical trials, a different methodology to produce DNA was used. This was PCR produced. So these contamination issues were not the same. When the switch was made, so-called bait and switch to process 2, the problems that were potentially there were not acknowledged. They were known about, but they weren't acknowledged, and I'll show that in the following slide. But for the purposes of a brief introduction as to how the DNA got there in the first place, it appears to have been the last step that wasn't efficient in terms of removing DNA and DNA mRNA or DNA RNA hybrids. There's an enzyme called DNase that is added to the final product in order to chew up and remove the residual DNA as part of the manufacturing and upscaling of the DNA using the plasmids and E. coli bacteria. And this resulted in an impure modified mRNA product. We think the reason this happened is because, as everybody knows, the uracils were substituted out for N1-methyl pseudouridines, and these particular bases are very, very sticky. And the potential for forming hybrids with DNA is therefore perhaps higher. And also the potential for these hybridized DNA, RNA hybrids to stay stuck together is higher. And this is problematic because these things called R loops can form, which are the excised introns from the DNA. And when you introduce these in terms of being wrapped in a lipid nanoparticle to a human body's cells, for example, this can induce a lot of problems such as cancer. The bottom line here is that the only thing that was meant to remain after the synthesis workflow was modified mRNA for packaging with lipid nanoparticles, but that's not what we got. As I mentioned, these R loops are potent inducers of DNA damage, and they're roadblocks to DNA repair. And in addition to cancer induction, we can have viral induced pathogenesis, neurological disease induction, and autoimmune disease induction. So it's quite possible that this is why we're seeing particular adverse events arising in terms of the clinical setting and also the pharmacovigilance database setting. As I said before, this can lead to cancer, and it's another mechanism of action that I suspect, and I suspect that this is behind what we're seeing clinically. Now, as I mentioned, the residual DNA was a known problem that was being mitigated in early 2021. We know this from our FOIA requested documents. This is one released or made by the European Medicines Agency in March 30th, 2021. We still don't have all the information, but it's very clear here that they were aware of residual DNA potential and that they were trying to mitigate it, but with not much success because of all the vials that were tested around the world. All of them were positive for DNA. The first files that were tested by Kevin McKernan, he's really the discoverer of this problem originally, showed that 1/3 of the nucleotides were DNA and not RNA. And this is quite alarming. And what's even more alarming is that these DNA levels are well above the EMA commercial acceptance criterion. And those criterion are based on naked DNA, not on lipid nanoparticle encapsulated DNA. So it's a much bigger problem than anyone can anticipate. And some of the officials who are reiterating the safe and effective narrative are claiming that the levels don't exceed the commercial acceptance criterion levels. But again, those levels are already too high. Of the DNA that was discovered by sequencing, Kevin found something called the SV40 enhancer and promoter, as well as antibiotics resistance genes. And these are all considered to be PRIs. Now, what's very suspicious is that the disclosed Pfizer plasmid map, as per the rolling rapporteur report, does not show the presence of the SV40. And according to Kevin, who's a genomics expert, that it means that it would have had to have been removed intentionally. On the right is the plasmid map as per Kevin McKernan's sequencing, and you can clearly see here the SV40 enhancer promoter. Now, this is very odd because SV40 promoters they're very, very strong, and they're used in a mammalian expression system, so they don't need to be here for the upscaling process using the plasmid E. coli system to work. What you need effectively is the T7 promoter, which is disclosed in the plasmid map by Pfizer and also in Kevin's sequencing result. And the enhancers, they don't need to be included at all in the plasmid. It's something that you add for a specific purpose. And it's also alarming that these are gene therapy tools used to traffic plasmids and DNA to the nucleus of cells. They're biotech tools. So it begs the question, what is it doing there? And what's the effect of it being there in the context of the human setting? These are questions that really need to be answered. Certain health regulators and authorities are very aware of this problem, thanks to our work. Health Canada has acknowledged the presence of SV40, and so have the EMA. And despite this, we have FOIA requested documents, thanks to Canadian journalist Noé Chartier, that reassert that they're very well aware that these SV40 enhancer promoter DNA fragments are in the vials. And they're actually trying to figure out from the EMA are trying to figure out from the FDA if they're going to do something about this. And we also know that the Health Canada rep to the CDC has made a completely false claim that the SV40 fragment is inactive and has no functional role. Now, the reason why I'm stating that this is a false claim is because there's no evidence to support that claim. There's no data. You can't make this claim in the absence of data. And considering what its function is as a gene therapy tool, it's completely negligent to say that because we don't know. The EMA rep asked, should the sequence have been disclosed to us? Should our analysis have been done earlier? These are all pertinent questions. The reason I'm including these slides, thanks to Scoops Magoo and Noé Chartier, is because it's important. It was important for me to understand, and it's important for everybody to understand that not everybody is acting criminally right now. There are certain people who are propagating these lies of safety and efficacy without doing any due diligence or work or providing references in terms of peer-reviewed literature or data to support their claims. Now, recently in Canada, it's been ordered by the Canadian government to destroy the XBB vials. And it's not known who actually made that order, if it was a pharma exec or Health Canada. But it's possible that these vials have been ordered to be destroyed to destroy the evidence of the SV40, because a new batch of XBB product are coming out in November, and perhaps they've been quote unquote cleaned up. The bottom line to this point is that the gene-based lipid nanoparticle platforms are not plug and play at all. There are persistent and unmitigated problems with respect to CKIs and potency and dose. And if it was up to me to say, I would say that we're never going to resolve the issues of dose because we're never going to have a way to quantify how much spike protein each individual human being is making and for how long. I just want to add that I have not even mentioned anything about additional problems with the platform, such as frame shifting, codon optimization, mRNA misfolding, double-stranded RNA, and lipid nanoparticle toxicity. So the self-amplifying RNA lipid nanoparticle technology is based on exactly the same technology as the COVID-modified RNA LNP products that continue to be riddled with unresolved critical quality attribute and potency issues. And for those of you who don't know, the self-amplifying RNA, which I will explain in a minute, has been trialed since 1920. It was one of the BNT 162 products that were part of the same clinical trial, NCT 043-80701. So they've been at this for a while. It comes as a surprise to most people that this is being launched in Japan right now as we speak. But they had every intention of unleashing this on the public from the very beginning, and the safety data is not there, and I'll show you that now. Self-amplifying RNA is a very different animal from so-called conventional modified mRNA. I wonder where along the line it became conventional. It is no such thing. Self-amplifying RNA it's a type of RNA molecule that contains both coding and non-coding regions, and it can synthesize its own complementary RNA strand using an RNA-dependent RNA polymerase, or RDRP, which allows it to replicate autonomously, and I'll explain that a bit more now. The claim by the manufacturers is that this self-amplifying messenger RNA is safer because you need to inject less of it. But I would contest that claim. So Dr. Bean makes a nice series of illustrations to help the layperson understand why this is different and how it works. So this RDRP protein is produced continuously. The first step is to insert this new gene that encodes the RDRP into a sequence that will eventually be converted into protein once it gets introduced into the cell by the lipid nanoparticle. So once that happens and the lipid nanoparticle dumps its payload into the cell, this RNA template is used to produce a lot of RDRP protein. This is effectively a photocopier of RNA. And what happens after that is that these new RNAs that are photocopied en masse are subsequently are introduced to new ribosomes for production of spike protein. And we don't know for how long this occurs, but we do know that even a minute amount, perhaps even 1 or 2 transcripts of original RNA can translate into a massive amount of spike protein because this comes with its own photocopier built in. The conventional modified mRNA versus the self-amplifying RNA is shown here diagrammatically. This is actually Anna Blackney's work. She's been at the forefront of this self-amplifying RNA product for a long time. And you can see here in this simple schematic that there's kind of an implication of a 1-to-1 modified mRNA to spike protein as displayed on the right, which is not how it is, by the way. It's probably closer to 1 modified mRNA to 1,000 spike proteins, but nonetheless, it's just for comparison's sake. But in the case of the self-amplifying RNA, you can end up with, from 1 transcript, you can end up with a lot more antigen. And this is not represented here, but it also translates into more antigen being presented on the cell. Ultimately, what this means for the cell is that it's going to become, all the metabolic processes, for example, are going to be exploited for use in producing these proteins, which is not going to do the cell any good. So although the amount of product injected is less, it's 0.1 micrograms as opposed to 30, it yields more protein in the end, and the antigen exposure is longer. And here are some very pertinent questions that everybody needs to ask their MPs and representatives if they're thinking about putting this into the public and environment. Does it turn off, and when? How will it ever be possible to turn off self-amplifying RNAs? Are the replicases self-limiting? Do the self-amplifying RNAs contain self-cleaving motifs that enable them to cleave themselves during replication? Is the segmented poly-A tail, which it has, resulting in longer duration? And is the risk of recombination with endogenous RNAs going to be assessed? Because this is also a potential problem. And how is this going to be assessed? This is the safety profile as per the trial that I showed you before with clinical trial numbers here. And apparently this has been unredacted, but the results are as bad as you would think they are. That came out after I had prepared these slides. So this is what this is what we have for now. The question remains, why was the summary of the safety redacted in the first place? I mean, the main reason to redact something is to hide the results. So possible outcomes of continued amplification of these products includes depletion of cellular resources, leading to a decrease in the cell's ability to perform vital functions. And the question that remains is, which cells is this going to be happening in? Disruption of gene expression that could impair essential cellular processes and lead to cellular dysfunction. Activation of innate immunity could cause inflammation and cell damage. I'm sure it does. Saturation of RNA processing machinery could impair the normal function of other RNA molecules, leading to widespread disruption of gene expression. Induction of cell death pathways, that seems obvious, and the formation of new double-stranded RNA intermediates is inevitable during self-amplification. And as I mentioned before, the metabolic cellular processes will be usurped at the expense of the cell. So the last thing I'd like to talk about is this is the vaccine adverse event reporting system, which is intention to detect safety signals in pharmacovigilance data for subsequent assessment of causality. In other words, are the safety signals arising because there are associated harms with certain products like these injectable products in the COVID-19 context. So just in general, as of May 2024, there were over 1.6 million reported adverse events in bears. And this does not include the underreporting factor. None of these numbers do. And it could be as high as 100 times, according to the literature. And in the case of the COVID products, 25% of these reports are considered to be serious by their definition, by the VAERS handbook definition. And this is 10% above the highest the highest level that you would expect for serious adverse events in terms of comprising a percentage of an adverse event data set. The highest is normally 15. So this is very concerning. There's no comparison between the reporting of adverse events in the COVID-19 context and the past 30 years of data, as you can see in these two graphs. On the left are all adverse event reports combined, and on the right are the deaths. There's a huge increase. And this has yet to be acknowledged. I don't mean assessed, I mean acknowledged by the owners of the data, which are HHS and CDC. And this isn't because more shots were doled out or whatever excuse the safe and effective narrative holders want to propose. A time matched the number of adverse events and the number of adverse event types between influenza shots and COVID shots over a period of 462 days. And although there were 2.3 times as many COVID shots doled out as per flu shots in this time frame, there were 118 times more adverse event reports in the COVID product context, and perhaps even more alarmingly, there were 6.2 times as many adverse event types. And what this means, or implies at least, is that this much broader range of adverse events differentiates this particular product, and indicates systemic damage and points to an immune system dysfunction, which I've been saying for years. This is more support for the claim that it's not about the number of shots, the additional number of shots. If you compare all the adverse event reports combined for influenza products in 2019 to remove the bias from 2020, and the COVID-19 shots in 2021, you can see that there's 25 times more reports per million doses. So this is normalized per million doses. And in the case of death, there are 70 times more in the COVID context. And in terms of cancer, there are 33 times more. So something is definitely different about these COVID-19 shots. And perhaps more alarmingly, that when you compare the last 3 years pre-COVID to post-COVID data, in terms of cancer reports in VAERS, the total number of reports per 100,000 adverse events is increasing over time, which is even more alarming when you consider the fact that the shot frequency, the administration frequency has actually been decreasing. So this is exceedingly concerning. So all in all, the recall of the products, as per the CDC, requires irregularity, quote unquote, and side effects. And there's a lack of adherence to compendial standards that has led, to both in the COVID-19 shot context. So recalls are justified. Critical quality attributes and potency assay assessments need to be addressed prior to any further use of this platform. And personally, I think there shouldn't be any further use of this platform. And this is where we need to go from here, of course. We need to help the injured. We need to call for a moratorium and enforce it. We should make it illegal to destroy the vials, especially considering the Canadian government is already calling to destroy them. This is effectively destroying the evidence, which should be made illegal, as I said. And we need to hold all those responsible accountable, and above and beyond hold on firmly to national and personal sovereignty. Thank you for listening and putting up with my cat bombing. And this is where you can find my work. I hope everybody enjoyed this presentation, and I look forward to seeing you all in person one day again. Thank you very much.